Hello and warm welcome to everyone joining us today. I'm your host Dalvinder Kaur from lovely Professional University. So let's dive into today's topic career pathways and future prospects in allied health sciences. Before we proceed further, allow me to introduce the expert of the day, Dr. Naresh Kumar, Associate Professor and HOD, School of Allied Medical Sciences, Medical Laboratory Sciences, lovely professional university. With 17 plus years of teaching experience, his expertise spans biotechnology, clinical microbiology, and public health. He has authored three books, six book chapters, and 20 research papers in reputed journals. He is mentoring 8 PhD scholars and has guided over 30 master's students. Before we proceed further in today's session, I would like to request everyone for any questions you can write in the chat box or in the Q&A box and in the end of this webinar. Now I'm going to hand over this session to our expert, Dr. Naresh Kumar, and it would be our absolute delight to listen from him. Over to you, Dr. Naresh Kumar.
Thank you, ma'am. Thank you so much. So, good afternoon to every listeners and all the people who are joined us. Thank you very much for joining. So, today I'm just going to talk about that what are the career pathways and the future prospectus in a public, allied health, professional, clinical embryology, etc. There are so many courses which are coming under the allied health professionals. Other than the pure medical, that is the MBBS, the other courses that is called the allied health professionals. And here we are today talk about the BSc Medical Lab Sciences, Diploma, PhDs, and the Master Degree program. That once you have completed this degree, what is going to be happen in your life? How is going to change your life? And what would be the benefit of it if you are going to complete it? So here, what is the first that what is the medical lab technology? Some people understanding that as the decades before, the few people are there who doing the testing, running into the machine, and that is the end of this medical laboratory sciences. But today I want to say that it's a very vast field. It has a several different kind of the programs inside that, different domains, as well as there are the different subjects also. So in a medical laboratory technology, we have the several subjects, and according to that, we require a lot of people to do the work in a specified laboratories. Here, if we just talk about that, medical lab technology, the field that focuses on the analysis of patient sample to aid in a diagnosis and the treatment as well as the research. So here the diagnosis, when the people are taking the sample, it is sent for the examination. They are going to do the some testing. After the diagnosis, once it is given to the doctor is prescribing the medicine. Now what is the effect of that medicine? Again we can check the laboratory analysis and we can find out that the effect of the treatment is going on or not. So that is called the treatment. So primarily diagnosis, then it is helps in a treatment and the progress of the treatment, what is going on, whether it's effective or non-effective, as well as in a research. As you know, sometimes the technologies are failure, diagnosis are failure. We are not able to diagnose the so many diseases. So every day new things are coming up, new diseases are coming up. So required the research also for medicines also, as well as for the testing also. Some disease we are not able to detect, so required the research field also into the same. So medical technologies play a crucial role in providing the accurate and reliable laboratory result. If the results are good, treatment would be good and the diagnosis would also be the good. So these are all are depend upon good diagnosis, good treatment, and good cure. Totally depend upon each other. This presentation will explore the key aspects of the medical lab technology and its importance in allied health care professionals. So just imagine here the role of the medical lab technologists, what they do. What is their role once they are going to do this BSc medical lab or the diploma or the master? What is their role? So their role is medical lab technologists perform wide range of the laboratory tests using the various instruments and the techniques. As you can see in a picture also, they are holding the autopipettes and so many laboratory instruments. So they are using it. They analyze the blood, urine, tissue, and other sample to detect the disease, monitor the treatment progress, and ensure the patient safety also. So ultimately, the whatever the fluid, whatever the material they are going to take out of our body, that is analyzed in a laboratory and they find out the disease. So suppose today we want to find out cancer, how it can be detected. Without the samples, we cannot detect it. So every single things which is happening inside body, first of all, we have to take the sample, send to the lab, and we can easily find out the disease. Then the treatment can be started. Medical lab technologists work closely with the healthcare professional, all the medical professional, all the radio diagnostic people, all the other people who are together, they are working. Without the diagnosis, treatment is failed. So ultimately, they have to work as a team, and until unless the diagnosis is not done, the treatment cannot be provided in a right way and accurate way. So timely and the best test result if we are giving, so treatment can be started very fast. What are the lab equipment and the techniques? Medical lab technologies utilize the advanced equipment as microscope, analyzer. These are the automation system. Earlier, there was a manual system was there, but nowadays, analyzers coming in a market. Reason behind, in a day one, we are receiving the more than 500 sample, 1,000 sample, and a big laboratories, 2,000 samples per day. It is not possible with the 8% in a laboratory. That's why the laboratory personals or their requirement is also increasing, as well as the automation system we required, so that the work can be hastened up and the diagnosis can be given early. So ultimately, the equipment such as the microscope, analyzers, and the centrifuge to perform the test, these are the basic one. They are trained in a various techniques, including the molecular biology, microbiology, hematology, clinical chemistry or clinical biochemistry, then blood banking, then you can say the histopathology or the toxicology. So many laboratories are coming under the medical lab professionals. These techniques enable them to identify the pathogens, assess the organ function, and analyze the genetic material. All these are come under this one. So there is a one important thing, that if we take the sample, run into the machine, is it the work over? No. So ultimately, the person who are doing the work in a medical lab sciences, they must have the some kind of skill who can produce the good quality of the report. So there the quality control, quality assurance in a laboratory, that basically confirms the laboratory reports which has generated from the labs at 100% dependent. So medical lab technologies adhere to the strict quality control measured to ensure the accurate and reliable result. They participate in a proficiency testing programs and perform the internal quality as well as the external checks also. So they are the quality control, internal as well as external. Some external agencies are sending that material to us. We are doing the reporting over there. Then we are sending back to that material to the particular hospital. Then they compare. The report which has been generated from this lab is 100% dependent. So this is called the external quality. But there must be the team of the internal quality. If we are producing the result, our results should be 100% dependable. It should not deviate the diagnosis. It should make an accurate diagnosis for the doctor. That is the prime responsibility of the every allied healthcare professional. Regular calibration of the instrument, maintenance of the equipment, essential to the maintain the accuracy and the precision. So laboratory safety, yes, of course, as you know, there are the lot of samples, HIV, HBsAg, and now during COVID, we have the so many people are affected with the COVID. So whenever the diseases are coming in a society or in a public, so ultimately it can also affect the personnel who are working in a healthcare. So they must take care of their selves also. It doesn't mean continue to do without any kind of protection. So as you know that during COVID, they have used PPE kits. Everybody knows nowadays. Medical lab technologists follow the strict safety protocols to protect themselves and the other from the potential hazards. Like HIV patient, you are taking the samples. Sometimes the needle-stick injury may be happen to you. So ultimately, the person has to save themselves also and other relatives also and the patient also. They use personal protective equipment wherever it is required. It doesn't mean for the simple blood collection we require it. No, there we required only the gloves, or we can maximum we can wear the mask if the patient is so weak, who may have some kind of the very fatal disease like a tubercle infection, which may cause the infection to the healthcare professionals. So in that condition, we can wear the mask as well as gloves, but PPE kit not required until unless the person may have some viral, highly contagious infection they may have. Proper handling and the disposable of the biohazardous means that causes some infection, that particular material are essential to prevent the spread of the infection. As well as emerging technologies in the medical lab sciences, as you can see over here, that there are the molecular structures that has been seen. So nowadays, the molecular diagnosis is important for the accurate diagnosis of the diseases. So medical lab technology is the constantly evolving with the new technologies being developed to the improved diagnostics, very fast also and reliable result also. Next generation sequencing. Now this is the one next gen sequencing. We also call it in a short form. Sometime if we want to find out the DNA damage happen and due to that the malignancy happen or disease are happening, we can also find into that. So next gen sequencing is also the one important factor they are playing in a diagnosis, and the rapid and accurate identification of the genetic variation. See, if the chromosome disorder is happening, for instance, and if we have the gene defects, one single gene defects in a Punjab as it is happening, beta chain deficiency, it may cause the some disorder which may require the high cost treatment. So that's why we can easily find out mother is carrying the baby which may be defected, which may have the gene defects. So we can easily analyze, and that baby once it is developing, we can terminate with a medical aid as per the instruction receiving from the government. But when baby develop and then we are able to find that it has a very high kind of the genetic disorder, so we have to save that life. So ultimately, cord blood banking or the cord blood testing, it can be easily seen through this next gen sequencing, and we can find the genetic defects. So point of care testing devices enable the real time analysis of the sample outside of the traditional laboratory. Sometimes nowadays they are providing the very small instrument bedside. Sometimes the patient is so serious, we don't have the time to even take the sample, sent to there. Taken a small sample, immediately done the test. So it helps in a immediate decision to the physician that can start the treatment. Now, importance of the medical lab technology. Accurate laboratory test results are the critical for the early detection and diagnosis of the diseases. Medical lab technologies plays a fundamental role in monitoring the treatment efficacy and the patient's recovery. Research conducted by the medical lab technologies contribute to the advancements in a medical science and the healthcare. Whatever the problems they are going to face in a treatment, who has to tell that to the research industry? Only these persons who are working day and night. So they would detect the problem, then it can be sent to the researchers. Researcher would find the some solution for it. Suppose we don't have the test to do the COVID first time. So who has done it? Researchers and together laboratory professionals. They come together and made a one kit. Immediate kit they have made for the testing. So this is the one teamwork. So ultimately, who is the user? Laboratory professionals, they are the users. They would face the some problem that they are not able to detect this disease. Whatever XYZ, whatever the disease is there, not able to detect it. So ultimately, they are going to make a problem. They are going to report a problem. This problem would be sorted out by the researchers. So in that way that work. So career opportunities in a medical lab technologies. Medical lab technology offers a wide range of the career opportunities, including the clinical laboratory technologies, laboratory managers, research scientists. Job prospects in a field expected to grow due to the increasing demand of the diagnostic testing, and continuous learning and the professional development are essential to stay updated with the latest technologies and the advancement. So there are a lot of opportunities, as I said, that there are the so many domain into this one. Small domain: hematology, biochemistry, histopathology, etc., etc. So the person required in every branch. Education and training means of the person have done the BSc medical lab science or the diploma. Medical lab technologies individuals typically need bachelor degree in a medical laboratory science or related field. Clinical training and the certification also required to practice in a medical lab technologies. Continuing education and the professional certification is also important for the advancement of the career competence. So here the conclusion, if I say medical laboratory sciences, medical lab technology is the vital component of the modern healthcare, providing accurate and the timely diagnostic information. Medical lab technologies play a crucial role in a disease detection, treatment monitoring, and the research. So all major things are there. And continuous advancements in a technology, as you know that today we require the AI. So what the AI can do? So as you are using the lot of gloves, now if you just use one glove and put into the machine and just give the command, AI is going to do so many parameters in a one go. No need to wear the gloves again and again, change the things, etc., etc. One time you just do the programming, and after that you will find the result is out. Simply take it and you can dispatch the report. So technology
Sorry,
ensured.
sorry for the interruption. Can you please change the slides,
Yes.
Dr. Naresh Kumar?
Yeah, I'm changing. It's not changing.
So yes, it's not changing. Can you please move to the next slide?
Yeah, now it's fine.
Yeah, that's fine. It's fine now.
Okay, fine.
Can you please continue?
Okay.
Sorry.
All right, no problem, no problem. Sometime what is happening once we are full mode now, it's not changing. So now I think it's fine changing.
Yes, sir.
All right.
Everything is fine. You can continue.
Uh, okay. So as I'm talking about that, what are the opportunities? Just look over here. The staff clinical laboratories may include clinical biochemistry if they do the masters in clinical microbiology, clinical biochemistry, right? These are the person who can go in a biochemistry, microbiologist, laboratory assistant, biomedical scientist in a foreign countries, US, Canada, medical laboratory scientific officers, medical laboratory technicians, clinical laboratory technician, medical laboratory assistants, phlebotomists only who collect the blood, histology technicians, scientific officer, medical technologist, medical laboratory scientific officer, application manager who does simply running the machine only. They are selling the machine also and telling them what is the application of it. Sales executive in a biomedical instrument and reagent supply. So these are all related to the profession. After BSc medical lab sciences and the master, you can do a lot of, depend upon how much you have taken a skill. If you are master, then you have the some separate job also. Bachelor and the DMLT, separate jobs are there for everyone. So if you just talk about the technology, now this is the one that instrument which is used, and most of the people are familiar that once you're going in any laboratory, we find a multitasking kind of the instrument where you can just do the programming over here. You are going to run the sample and very easily you can get the report. These are the automation system. Automation system of the hematology, which is deal with the study of the blood. So this is the one Adway 120. It's a total one. Once you are going to, it's a closed system. Simply just put a sample here, it's going to mix, then it's going inside and the sample, and finally the report is coming out. This is how the wonderful kind of the instrument is available nowadays. So this is the automated stainer also. As we are earlier, we are doing the manual, but there are the some time differences are there. Due to that, there are the chances of improper staining. So ultimately, if you are taking this automation system, it has the timer also, and finally the programming also, in which chamber for how much time you want to keep that slide. So this is the one automation system for the staining. So if you just talk about the microbiology, Vitec 2, and antibiotic sensitivity and a bacterial identification. Earlier we are using the some kits. If you want to identify what is the bacteria it is. So how to identify that this is the typhoid? How to identify this is streptococcal infection causing the sore throat? So there are this one, the machine is available to test the antibiotic. Antibiotic means medicine also, and to identify the bacteria. Both the things are available in a market. So it is a one microbiology along with the the latest technologies. So here if we just talk about the blood bank, this is again, earlier we are collecting the whole blood, but now during the dengue season, sometimes we required only the platelet. Platelet are the cells which helping in a coagulation system, which is stopping our blood once the injury happen. So these platelet, once the bleeding is happening in a someone, only the platelet can be collected and that can be sent for the patients or the recipient. So now we do not require the whole blood. If you want to give platelet, give the platelet, rest of the things would go back to your body. RBC and the other material that would go back to your body, only the platelet would come. This is called the cytoapheresis machine in the blood bank. This is as I talk about the molecular biology system, that how they are using to detect the gene defects. And this is the one picture I'm showing, that the working of a medical laboratory scientist who are working in a laboratory, what is their life, how they are busy into that one. You just check over here. Huh? So that the microbiology people, and they're working on a microscope, then an automation system, and they are measuring the biochemistry analysis they are doing. So here as we are talking about the single this medical laboratory professional, whether they are DMLT or BSc or clinical microbiology or biochemistry, they have the opportunities in this particular field. Research, pharma, process, product formation, quality assurance, compliance report, development of the diagnostic kit, clinical research management, hospital, biomedical scientists. Those, this is the one huge kind of the opportunities are available once you are going to complete this medical lab sciences program. So if we just talk about the entrepreneurship, if the people are not getting the job, as the scenario sometime it is happening, but I would say in the medical science there is no too much hike or the drop. It is a simply kind of the very good and a smoothly upgrading field, and smoothly it is going. There is no dip into this field. So the person, if they don't have the job, they can start their own work. DMLT person, diploma in medical lab sciences, they can start their work, but with a limited testing. Bachelor of medical lab sciences, they can also do, but some they can do almost, if I say once there is 100, so they can do almost 90% of the testing. And but the clinical microbiology, clinical biochemistry, and clinical embryology, so these all people have their right to open their own business, either clinical embryology if they are doing, or clinical microbiology or the biochemistry, or BSc MLT. They can start their own laboratory also with a registration at a center as well as in a state wise. So the person, if they want to go in a higher education, diploma they have done, they can go for bachelor laboratory sciences lateral also or fresh also, and they can start their own job, they start their own work, as well as they can go with a clinical embryology if they have done the BSc MLT, clinical biochemistry, or clinical microbiology. They have the opportunities in a higher education after this doing all this diploma and a bachelor degree. Ultimately, again, if they want to go for the some research also, and with a higher education, like they want to become an assistant professor, professor, lecturer somewhere in an institution, they can go with the PhDs also. However, after the master degree, they can get the job in some colleges where they are taking the master student also, and so many students are working still. But if they want to go in a little bit big institutes where the PhD is the demand, so they can go with a part-time or the full-time PhD, and they can do their work along with the job. So this is the one opportunities if the person want to go in a higher education. So own work is also there, jobs are also there, and higher education is also possible after doing this field. So there are the some information I want to give all the persons who are listening this one, that all medical professional, they must go for healthcare professional registration. So there the link has been mentioned on a website. Simply just put this one, allied healthcare professional bill. So there you may find a registration. The people who have completed their diploma or the degree or the master, they can register with them. So this is the kind of central agency who is registering the allied health professional or medical laboratory professionals. So their record would be at a center. Later on, it would be transferred to the state also. So now coming to the another one. So hope so that you are able to understand the bachelor in medical lab sciences, how it can be useful for you, the person who are listening. Okay, so what is their role and what are the job opportunities that I already discussed. So now another course we have the assisted reproductive system. Assisted reproductive, or you can say IVF laboratory, very common, that where the people are facing the problem, they don't have the conception, mother is not able to conceive, mother is not able to get baby, they don't have the children in their family. So nowadays the techniques may available. So these techniques is only helpful in a artificially that fertilization. So ultimately whenever there's a oocyte is there, sperms is there, sometime in a natural way it may be anything else wrong with the female or the male. But ultimately we have the technology, we can purify the sperm also, we can purify the oocyte also, we can take in a laboratory, then we are just simply fertilizing it. And once it is fertilized, after that we are just growing into the machinery system. How this is, you can see that in LPU we have the good instruments in our lab. So here if you just look into this one, this is the one what I want to show you. This is the one machine where we are just taking the spermatozoa of a person and the oocyte. So this is the oocyte which is gray in that color. So this is the one needle. So the person who is holding this from this side, they are taking the needle, very small fine needle, it can be seen under microscope only. And this is the another end, from here he is holding the oocyte. So this needle is containing the sperm. So this sperms we are sending, just inserting into the oocyte. So after that, what is going to be happen? We are going to keep in an incubator. So this incubator is here. If I just I'll show you. This is the one incubator we have. This is the what we are doing in under the microscopy. and this is the incubator in which we are just keeping it. So there are the time with है ना 24 hours, 72 hours, 3 days, 4 days, 7 days. So ultimately when the egg is fertilized, spermatozoa and the oocyte, so there would be a development of this fertilization. So there are the 2, 4, 6 and 8, 16. In this way the egg would start to fertilize. It was the division would start. So ultimately this is the one stage which is known as the blastocyst. Once this we reach there, so here we have to add the three different kind of the gases. So these gases we are added. So in this one, once we are going to add these gases, it would develop into the incubator. This incubator having the similar kind of the temperature and the oxygen level and the humidity as in a mother's womb. So same things is provided in this chamber. It's very quite costly, almost more than crores rupees of the things are required to set with this one. So this is the one where we are just putting this egg. This is the one we have done, then we are putting into this one. It would develop into this one. So once it is developed, then after the development we are able to find the some picture outside. This picture would tell us that the egg has been developed. So after that, once it is fertilized, this we are going to give. And if I'll show you the another picture, this is the one where the instrument, we have this instrument. After taking it, we are just checking under this microscope and we are finding the same stage. If we are able to find the same stage, then it is over. Now this egg would be handed over to the doctors, gynecologist, and the gynecologist is going to implant in a mother's womb. So this is the work of the embryologist, that from the day one, if the infertile couple is coming who do not have the baby, through the counseling and they are calling at a center, definitely they are going to meet with the gynecologist or the andrologist. They are going to plan it. So they are going to give us some medication. They are taking the oocyte, egg for the mother and the semen from the father, and then it is processed. This is the one incubator we are going to process in this one. And this is one of the best instrument, as we also have the same, that it do not allow the mixing of the sample of any other person. So it start to give the beef. This is the one highly kind of the AI generated, AI kind of the control of this system. So ultimately once this has been developed, it can be given to the uh, gynecologist is going to implant in a mother's womb, and then the baby would develop in a normal way, and finally the delivery would also happen in a similar manner. So only the work of the embryologist, that they have to develop the one kind of embryo. So this is the one embryo developed after the fertilization of the mother's oocyte and the father's sperm. So this is done in this one. So in this one we also do, if the sperm is not good, only we require the few sperms which we can take from the millions of the sperm. We can take the good one also. Oocyte is also we can take, and we can fertilize in a lab. And after that, this is the normal. Simply it is the mechanical system through which we are doing this one. So this is the work of the embryologist. And if there is any delay that it cannot be implanted, it cannot be put in a mother's womb, then we can have the system in which you can store the semen also. Cryopreservation you can do. Spermatozoa can be saved into this one even up to the next 10 years, simply that we keep into the liquid nitrogen. So this was hope so that you are able to understand that what is the work of the embryologist and what is their role. So embryologist, almost 90% they do, 10% is for the gynecologist who has to put that embryo. Now coming to the next opportunities, that is the one optometry. Optometry, as you know, that the specs, most of the people having the eye vision issues, because of the mobile, because of the technology, their screen time is quite high. That's why the most of the people having the headache. So it's maybe the chances that the person may have the low eyesight and the eyesight issues. So ultimately the demand is increasing. So optometry as a career, if somebody is going to do this optometry bachelor degree, so they can have the good opportunities. What is the metry? The term optometry comes from the Greek words opsis, the view, and the person who not able to see. So this is the one from where it has come from. Optometry is a healthcare profession concerned with the eyes and related structure as well as the vision. Some people have the squint eyes, their eyes they cannot see properly, their alignment is different. So all things can be resolved into the some maybe require the operation also, some required the only the spectacles that they can do it. So visual system, vision, information processing of the human, that can be done. Okay, so what will be become, they become the optometrist. The person who does the bachelor degree in optometry, they become the optometrist. And how will become this one? So they need bachelor of optometry, honors optometry, bachelor ophthalmic techniques, or doctors of the optometry, OD, or BS vision science. So different kind of the degrees are there in India and outside of the India. So after 10 plus 2 medical sciences, they can go for it. So bachelor of optometry, very simple, and honors also on optometry. So bachelor of optometry, these are all the healthcare professional degree. The person who does, they can become a optometrist. So what they do, what they would learn, what they are going to learn into this one, they would learn every issues related to the problem. So if you just see some people having the eye vision issues, है ना, they have the cornea damage, sometimes they require the surgery also. Yes, they assist the eye surgeon. Eye surgeon is that who has done the MBBS, and after that they have done the specialization course of the eye. But optometrist is the person who basically helps in a eye vision checking also. Dilation is what, the person having the problem in a cornea, they are putting the one medicine, finally the cornea is dilated, and behind that cornea you can see that what is the problem. So all these things can be seen in the eye. So the people who is an optometrist, as well as the one ophthalmologist, the person who is dealing with the totally the eyes with the surgery also, and their internal, and they are doing the intraoperative things also doing. So their work is different, but related to the ocular, wherever the physiology, everything they have to learn. Only they are not to do the surgery, but they have to assist during the surgery in a laser and etc. They are the part of the team, but they are not supposed to do the surgery. They have to collect all the samples. If the infection is there, they have to just make the spectacles also, right? But they have to help and making the new kind of the spectacle. So as you can see that there are a lot of companies who is there, who can make the lenses also, and bifocal or progressive. Nowadays the very good techniques of the this optometry is coming up. So there are the lot of branches of it, it's not a single one. So now what to do? What do we do? So optometrists are primary healthcare practitioners, eye and the visual system. And as you can see, who provide the comprehensive eye vision care and includes the detection, diagnosis, and non-surgical management. Now here is the word, I think you may be understanding it. Non-surgical. They are not supposed to do any surgery. Rest of the things, whatever the one person who is doing, they have to check everything. Disease also they have to do. So surgical or ocular diseases, refraction, dispensing, rehabilitation, congestion, and the visual, all these things they have to take part into this one. They are the first point of contact to the ocular conditions. So ultimately, है ना, the person, hope so that you may be understanding, सब कुछ ऊपर से नहीं गया होगा, you may be understanding everything. So checking each and everything of the eyes related issues, they have to optometrist has to do it. So career option, what would be that? Once the person are doing, they can have the option after bachelor, they can go for the master as well as PhD. They can become the professors also in the universities who are running these courses. Multinational companies, optical industry, contactless industry. Now this is the one fashion. The people, they want the similar kind of the lens also with the dress also. Right? So nowadays the fashion is also going on, and the girls especially, they don't want to wear the specs. If they don't like it, they can have the lenses. So lenses you can put on a directly on a cornea, so it would it won't seems to be like a spectacles as I'm wearing. So ophthalmic equipment industry, they are making this all instruments. I was talking to the one person that how the people are making this so many opticals now. There are the required is high. So he said nowadays automations is coming, and its cost is 4 crore rupees. It means they preparing the some instrument how to fix the this spectacle. So companies are also working, they require the in a sales also to make the everything. So private hospitals, yes of course, private clinics, government hospitals, optometry clinic, and optical shops. Now the people who are simply selling, they are checking through the computer that this is the eye vision. Once they are found, or they are taking the numbers from the doctor. They're coming and they're making the spectacles and they're giving, so they can start their own business also. So teaching is also there, है ना? And the eye care and the public health related. Okay, so this is the one higher study as I talk about. Vision abroad, anywhere you can go. So this profession also having all opening in India, outside in India, education, as well as entrepreneurship, sales, marketing, so many things. Okay, so multinational companies we have, so the people require the trained person, consultant they requires, can draw the strategy, business plan for the MNCs, clinical application specialist, desirable qualification. If the person are doing bachelor, after that they can do the MBA if they have the interest to sell only the optical related instruments. So now just it's a kind of a look. What is the work of all these are the optometrists, all these people. And now they're checking where is the problem. They're going to add some medicine into it. They're the machine who has to check it. So all these things are done by ophthalmologists also and the optometricians also. They are also continuously helping in a detection of diseases. So they can start their own practices as I already talked about. Teaching they can go for that, the optometry tutor, demonstrator, etc. So there are the they have the good opportunities if they are going to want to do. Now coming to the next this one also, next kind of profession, that is called operation theater and anesthesia technology. And operation theater, what they do here, you can just see this is the one structure. There are the lights and this is the one table, right? And here is the anesthesia table, right? There are the some trolley which are carrying the crash trolley, which is known as, if the somehow the anesthesia given too much, sometimes the patient even they may have the cardiac arrest, so immediately they can do the treatment and they can survive. Sometimes the people are even dying with the anesthesia. Body to body it is totally depend. So the person who is working over there, they are the anesthesia person. Along with the, if you are going to do this operation theater and the anesthesia technology, they can become the operation theater persons, right? As well as the anesthesiologist, means they have to work along with the physician. There are the anesthesiologists or anesthesia doctors. Along with that, they have to arrange each and everything. They have to fit all the pipes and etc. They help the anesthesiologist, because the anesthesia in a one department, it's not possible the one person has to remain ICU, CCU, where the anesthesia is going neuro ICU. So nowadays in operation theater they have the separate one. The one anesthesiologist they required at a several places. That's why the person they are giving, they are training the person so that they can take care of in ICU, CCUs, and other than the operation theater. So now there are multiple places their requirement is increasing. So it is a good kind of the profession if somebody is going to do operation theater and anesthesia. So here the person do the surgery. This is all these people who are working together. The one nurse may be there and the one person may be there who is helping in a surgery. So what is happening during this one, they have to hand over all the equipment they are doing surgery. So they are not talking because they have the mask around their on a face also. Simply their eyes, they are working, they are blinking, and simply they are moving their faces also. Through that they are able to understand. The one person who is working along with the team, they should know if they are doing the cardiothoracic surgery, what they need next. So they have the practice what instrument we have to give. It doesn't mean every time they have to say, okay, give me the Caesar, give me this one. They are not going to say this one. Now the person who is standing over there doing the surgery, they know what the next instrument is required to remove that next kind of the things. So this is the training. And here is the this anesthesia through this one nasal system they are giving. Otherwise the spinal is also given from the spine cord. They are also giving the anesthesia from the this face is also there. They are giving different kind of anesthesia is there. So career option as the BSc operation theater, the job profile such as the operation theater technician, anesthesia technician, surgical assistants, lab technician, medical technologies, this anesthesia technologies, assistant manager. They have to arrange for each and everything. The scope of the career opportunities of the BSc operation theater technology is widespread across the government, private, healthcare sectors, India as well as abroad. It is a 4-year undergraduate course designed to strengthen the knowledge of the various surgical procedures among the aspirants, as some top recruiters offering the bachelor or the BSc in Operation Theatre Technology, India, Max Healthcare, Fortis, Manipal, Anna, LPU, so many now the institutes are coming up, right? And this OTT, BSc can also opt for the higher study in after the OTT. So the student will learn about the equipment management responsibility associated with the operation theater, assisting surgeons, doctors in action. Role of the BSc Operation Theatre Technology graduate is to be present in the surgery room, assisting the doctors and nurses at the time of the surgery, specialized skills required for the procedure. So what skill they require? They have to be there. What they need next? So immediately they are just doing this, this a kind of communication without speaking. So program focuses on a training of the student in various aspects of the surgical procedure, including the assisting surgeons, preparing and understanding the operation theater, sterilizing surgical instruments, managing surgical supplies, and understanding the anesthesia. All these things to be done by the operation theater and technology. So their career option are bachelor degree, surgical assistant, clinical research assistant, sterile processing assistant, then outpatient surgery coordinator, lab technicians. They help in a planning of the research project also, sterilizing, disinfection. Sometimes the patient surgery done, after that the treatment not, the surgery is not good or is failed. Reason? Because there may be the infection in a operation theater. So who has to manage? The person who is the trained in that. They have to manage each and everything. After the surgery, there should not be any infection. Immediately they have to remove it and make a sterilized. Whole room is to be sterilized. Then areas of the employment of a BSc Operation Theatre, just see research institute, healthcare consulting, especially clinic, pharmaceutical companies, technical skills, patient care skills, crisis management, emergency. Now suppose we have the several emergencies may be coming somewhere, earthquake is coming, wars are coming up. So immediately whenever they require, all these people are going and doing the work. Every person who have the skill, immediately they are required at the time of the emergency. So this was the part. Simply I've just said the thank you Anna for this one. So this was related to the all three courses: BSc MLT, Operation Theatre, and clinical embryology, microbiology, biochemistry related, where the specialized course they can do, and after that can have the good work. Even a BSc clinic masters in clinical microbiology and biochemistry, if they want to do, they can become the professor and assistant professor lectures in a medical colleges also, and they can become in a another university colleges also. All right, so that's all from my side. If you have any question, you can ask.
Thank you so much, Dr. Naresh Kumar. As I can see, there are some questions from our participants. Can we take the questions, Dr. Naresh?
Yes, 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 sir.
Yes, Radhika is asking here, what are the most in demand career roles in allied health sciences today, and how are they expected to evolve over the next decade?
So basically, yes, of course, as I said, BSc Medical Lab Sciences is a one of that, because the still there are the problems are happening. Diseases are not timely diagnosed. So the people are required in this one, so that they can easily reveal, or the technology is required more, so that in a very fast way they can diagnose the disease and the treatment can be started. So still it is in a demand. And the next, otherwise the embryology now it's growing, so that is the another thing. But fastest, as well as I would say, it's a medical laboratory, because it's a many field, it has a many demand, this domains.
Thank you so much. I hope Gurpreet you got your answer from our today's expert. Someone is asking here, what are the global opportunities for allied health science graduates, and how can international certifications enhance employability?
See, if I just talk about the all allied health professionals, either optometry or medical lab sciences or operation theater, basically there are the requirement in almost all the countries. This is comes under the skilled professionals. So if they want to go in a right manner, so in every countries, if I just take the example of the UK, we have healthcare professionals council there. So the person who want to apply, if they have done any degree out of this all allied healthcare professional, and whether it's a optometry, medical lab sciences, or diploma, etc. right? If they have done it, simply they put their application, they are going to compare it, and they would send you the application. After that, they would register primarily, and once you are able to give the answer or able to fulfill their requirements, you can easily go into any country as a biomedical scientist. One, two, three, four different kind of the gradings they have.
Thank you so much. I hope, dear, you got your answer from our today's expert, Dr. Naresh Kumar. So, Karandeep is asking here, how can specialization in areas like medical laboratory technology, radiology, or physiotherapy influence career growth and job opportunities?
You're talking about radiology, right? So
Yes.
basically, and if I just talk about radiology, so radiology, earlier we simply knowing that it's a kind of that X-ray we have to do, ultrasonography, right? So nowadays, one more kind of that PET is there, na? Positron related imaging technologies are also coming over there. MRI, which is the most required, a very thin kind of the things they can easily reveal with the help of the technology. AI has involved into that. So sometime earlier we are not able to know the very minor kind of the problems or the damage to the tissues, damage to the nerves. So nowadays the techniques in imaging technology, if you are a master degree, if you have, you can easily go with that, and you can have good opportunities in advanced technologies of the this radiology. And you have asked the another course is, what is that? One more course you have asked for?
Laboratory technology,
Yeah, in
physiotherapy
a
influence. Yes.
uh, and a laboratory technology, as you know that if once you have the master degree like microbiology and biochemistry or the embryology, you can go ahead all having their demands separately. Microbiology, we require the microbiologists in a hospital as well as in industry and a research also. Biochemistry is the similar, and the embryology, as you know, that the IVF centers are increasing a lot. That's why there is a high demand of it also. Another, the physiotherapy. Physiotherapy is at a master level. And see, physiotherapy is what? Wherever the medicines are failed, they are not able to do it. And medicine cannot cure. Or after the surgery, cardiothoracic surgery, or the person have a disability, a very long time they are getting up from the the bed after the long illness. So ultimately, the physiotherapists, they have to do the treatment. It is slow, but their recovery is totally depend upon the physiotherapist. So good physiotherapists with a precision kind of treatment, still it is demand in India and outside of the India. All these fields.
Thank you so much, Dr. Naresh. I hope, Karandeep, you got your answer from our today's expert. Dilpreet is asking, how important are skills like communication, data analysis, and empathy in advancing within the allied health sector?
See, in data science, if I just talk about, I may not be expert, but I'll give what I have the knowledge about it. So ultimately, the data, what we required, you know, there are the people who are collecting the data from the sources, from the hospital, patient treated with, patient diagnosed with, but not able to cure. So why the people not able to get the right treatment? Where the problem is happen? So diagnostic part, treatment part, all these things are basically they are analyzing and finally deciding where is the problem is happen. So this is the one where the data analysis we can do, and we can now find out the problems and it can be sorted out.
Thank you so much, Dr. Naresh Kumar, our today's expert. I hope all the participants got the answers from our expert. If anyone have any questions regarding the admissions, you just write on us at admissions@lpu.co.in, and you can do WhatsApp chat with us. Our WhatsApp number is 985256900. I'm repeating the number. It's 985256900. Thank you so much once again, Dr. Naresh Kumar. As
Okay,
we
thank you.
come to the end of this webinar, I want to express my deepest gratitude to our experts for sharing their valuable insights and expertise with us. Your presence, enthusiasm, and active participation have made this experience truly special. Hopefully, the attendees found this webinar to be valuable and will be able to utilize the information for better decision making regarding admissions. If anyone wants to access this webinar again, they can visit our website, that is lpu.in, or can be accessed on YouTube also. Stay connected with us for future webinars. Until we meet again, with the permission of my seniors, I would be signing off this webinar. Take care and goodbye. Have a good day.
Okay.